You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us we have North Dakota's go-to dentist when you want to get a brand new smile, Dr. Derik Hoerner. Dr. Hoerner, welcome to the program.
Thank you, Randy. Glad to be here.
Good. Now, I know you brought a lot of photos, so we're going to try to get to as many of those as possible. Now, for people that don't know your practice, who's the typical dental implant patient?
You know, Randy, there's lots of different patients, but typically it's the patients that have bad teeth. And, you know, they might have a bacterial infection or loose teeth or teeth that just hurt. And those people feel like they're headed to a denture, and that's why they come to us.
Okay.
The second group of people actually are already in dentures. And, you know, honestly, they can't eat the foods they like. You know, we're in North Dakota. People love their steak, you know, and honestly, with a denture, they have a really hard time eating steak, you know, so those are the other type of people that we typically see. And for those people, we have a solution where we can give them upper and lower teeth that do not come out, so they can now eat the steaks that everyone else is eating.
Okay, now very nice. Now your center and where you do dental implants, I guess how dental implants are typically done is you go to one place that does a surgery, another dentist that puts the teeth on top, and then possibly an imaging center. At your office, you do it all right there. You do both parts. Is that why you're able to do it so quickly?
You know, that's actually what makes us unique in our area. You know, typically the dentists in our area, what they do is they send you to an oral surgeon. And everyone knows in North Dakota, you have to wait a long time. Typically, these patients are waiting 6 months just to get a consultation with the oral surgeon, another 6 weeks to get their implants in. And from there, they get put in a denture. The one thing that they were most afraid of, they're getting put in a denture. Not my office. We'll see the patients typically for a consultation on a Monday, surgery on Tuesday, and that day they are walking out with teeth that do not come out of their mouth.
In 2 visits, they can get upper and lower teeth that don't come out.
Absolutely, and it's all because of the technology that I brought to Bismarck and the stuff that we use every day. And we have actually really great oral surgeons in Bismarck, but the thing is, they are so busy. There are so many kids and people that just need regular extractions. They typically don't have time to see these patients.
Okay, good. So your center, because when we talk about teeth in one day, I mean, literally, you go in they meet you, you get the images, things like, so it might be 3 visits, but so like the day after tomorrow, if you had an opening, the day after tomorrow, you could have upper and lower teeth that don't come out.
Absolutely.
Is that right?
Yep.
Happens every once in a while?
Happens all the time. You know, I do these surgeries daily, you know, so people's lives, you know, we change people's life one at a time, you know, but for that person, it's a great thing.
For people that have no teeth and you give them new teeth supported by implants, how soon can they eat afterwards?
Typically, my patients are eating that afternoon.
Okay, and they could eat like chewy things like nuts or steak or pizza or.
Yep.
Like there's no limitations.
There's no limitations, you know, and that's really what this is about, because the solutions that typically we had in the past, a denture, you could eat everything but, you know, so there is no but. We're bringing patients back to full health, no compromises.
So in North Dakota, are there a lot of people wearing either an upper or lower denture or headed to dentures?
Ronnie, there are actually thousands of people wearing upper and lower dentures or heading to dentures. You know, these people, they could be your next door neighbor. Typically, there are more people than you think. You know, in North Dakota, we have a team. We have the Bison, you know, and they're actually national championship football team.
Okay.
And people love watching the Bison. They play in the Fargo Dome. The Fargo Dome holds about 18,000 people. If we were to add up all the people in North Dakota that were in dentures or headed to dentures, we could fill the Fargo Dome 5 to 10 times. So there's significant the number of people that have this problem.
So a lot of people. Well, if dental implants are so good, why aren't they all doing it? Getting a brand new upper and lower teeth supported by implants that don't come out.
You know, honestly, most people don't understand what's available because they've been going to their dentist, real nice guy, for years, decades even, and they'll typically take out a tooth, they'll take out another tooth, they'll give them a bridge, they'll give them a partial denture, something that comes in and out of their mouth. They don't want to end up like their grandpa or their grandma, so they just don't go in. If you're already wearing a denture, you don't even know what options exist. You know, you think you just need a reline, but you know this is not the case.
So they don't go to the dentist. That's why they don't know their options.
They don't even go to the dentist. And if they do go to the dentist, maybe they're going to a dentist that doesn't even know what options exist.
That
to
doesn't
help
do
these people.
implants.
They don't do implants.
So this is like, for example, throughout the U.S., it's like the new thing in dentistry. And you're one of I'm trying not to side with you, but you're kind of one of the pioneers in this whole digital dentistry movement of giving people new teeth again with implants.
Yes, absolutely. Typically patients they'd go to a center maybe in Las Vegas or in Dallas, Texas, but I wanted to be able to bring this solution to the people of North Dakota. Back to your original question of why everyone's not coming in to do this. Some people actually think they're too old to have this done. This is not the case. It was many years ago, but
how old can you be?
Honestly, my oldest patient is 85 years old.
Wow.
So people are getting this done because ultimately what's happening is people are living longer, healthier lives. And so we have a solution to help them. This 85-year-old had lived decades. Honestly, he's twice as old as I am, but he came in, he couldn't eat. And he said, you know what? I want to be able to go out to the cafe. I want to be able to take my wife out and eat the foods that, my buddies are eating. And so we had a solution for him. We were able to give him implants top and bottom. Honestly, people don't even know he had any work done, other than the fact that he can eat what he wants and he's always smiling.
So upper and lower teeth supported by, how many implants does it typically take?
Typically for my patients, they'll get anywhere from 4 to 6 implants for the top, same for the bottom.
And they're just attached on there. And then they go in for cleanings just like regular teeth.
Yep, it's just like having regular teeth again.
And now tell me about the process. So how does that work? So somebody comes in, either they're of the two categories, really bad teeth that have to be removed, or the denture wear. What happens on day one? What's that process like? Like how soon before you tell them you can do this?
Honestly, I'll see my patients for a consultation, and then we use state-of-the-art 3D imaging, intraoral scanning, and we give them a treatment plan that day. And we'll typically see them back the next day for surgery if that's what they wanted to do, and they'll walk out with their new teeth.
Okay, when you say intraoral scanning, what do you mean?
We use a state-of-the-art scanning where we don't have to use the goop. That goop that your dentist used to put in,
like to make a molding amount?
you
don't. That's gone?
No, that's gone. We don't use that anymore. So this is just another advancement that we have to give the best possible care to our patients.
So it's like a little wand, like a pen, almost.
Yeah, basically like a little wand. It feeds information into the computer, and we're able to use that data to design the smile for the individual patient.
So you have an in-house lab right there that makes the teeth?
We have everything in-house. What I like to do, and not every dentist will do it this way, is I like to actually design the teeth myself with some of our planning software, and I'm able to give the person the teeth they've always dreamed about having.
So on a computer, you're kind of planning the teeth on the computer?
Yep, it's a full digital process we've actually instituted into our facility. And after we take that design, we're able to 3D print, and we're able to mill their final zirconia teeth and give them a beautiful smile.
Do they get to see what it's going to look like? Like, you've designed it on the computer. Do you get to show them?
Patients are involved every step of the way, so they know exactly what they're getting.
Okay. Now, you mentioned your oldest patient was 85 years old that got upper and lower teeth that didn't come out, supported by implants. What was that like?
For him, it was a game changer because honestly, he just gotten used to having the status quo. And that guy, he couldn't eat, he didn't like to go out anymore, and honestly, it was a constant cycle. And everyone knows this cycle where they've had a tooth go bad, they needed a root canal, tooth broke, he got that tooth taken out, he got another tooth taken out, and he got to the point where he couldn't eat hardly anything, unless it was a undercooked hamburger, he couldn't even chew lettuce, and so
wow.
Finally, we were able to give him something where we rewound the clock on him 30 years, where he can now eat the steaks he likes, eats the food he wants.
So what do they like more, what they can eat or the way it looks, like their new teeth?
Most of my patients come in, they want to improve their smile, but what they find out is, hey, they forgot all the foods that they stopped eating because they just avoid those foods. But soon after, they're able to feel better, they look better, and they're able to eat what they want.
So they can eat chewy things. What about nuts?
Nuts, everything. Steaks, salads, it doesn't matter. They can eat it.
You brought some photos. What are we looking at?
You know, Randy, this is my first patient. Real great guy. He's actually equipment salesman. And, you know, he just gotten to the point where he was missing so many teeth. And he's like, honestly, I can't do this anymore. And he wanted us to give him a solution. At first, he wasn't sure he wanted to go through this, but then we showed him pictures of other patients that we helped. And then he said yes.
So like what, he couldn't eat?
Yeah, he couldn't eat. I mean, honestly, he's missing most of his teeth on top, you know, so just sandwiches, you know, and he wanted to eat more than that, you know, and like I said, back to the steaks, you know, and so.
Was his option a denture? Like, is that what typically where he would have been?
The dentist that he saw before me told him that he needed top and bottom dentures. And, you know, he said, I don't want to go this route. He knew there had to be something else, and that's why he came and found us. And we gave him a solution that was not dentures. He came in, we numbed him up, kept him real comfortable with our sedation, and in a few short hours, he left with new top and bottom teeth.
He's looking good.
Yeah, for him is absolutely life-changing, you know. And this is not atypical. This is actually typical for our patients that come to see us. If you look at him, Randy, he actually looks like he's years younger. He looks happier.
That's true.
He looks more successful. You know, he should have much easier time in sales.
Now those are white teeth. They look good. Do they help choose the color and shade and things like that?
Yeah, honestly, I give my patients a selection of 10 different colors, and you know, so they get to choose the color that they want. And for him, he always wanted whiter teeth, and we gave him exactly what he wanted. You know, if you look back to his pre-op photo, Randy, you'll see how he shows a lot of gums, and it's just not a natural smile. The smile that we gave actually fits his mouth perfectly. The teeth go from one end to the other end.
Was that done on a computer? Like to make it like that exact? It
was designed on a computer, and like I said, this is all part of our unique process that we use every day.
You say men and women have totally different shapes of teeth.
Men and women have different shapes of teeth, absolutely. You know, women's teeth are typically smaller, men's teeth are typically larger, and that's why we design them exactly for the patient. Randy, let me show you this next patient.
Okay.
She was actually in a denture, and she just had so many problems with it. So honestly, her two options were either get another new denture.
Like a new cosmetic denture.
Yeah, a new cosmetic denture, or something else, teeth that stayed in. I wanted to give her teeth that stayed in because that's what she wanted. She didn't want to have to worry about going out with her friends and her teeth falling out of her mouth. Look at the before and after.
Side by side, yeah.
Yeah, I mean, she had nothing, you know, and we gave her something that was custom to her face. From everything from the front teeth to the canines, everything's custom. It follows the lip line.
So like the teeth follow that lower part of the mouth.
You got it.
So you do that on the computer, or that's somewhat your hands-on design?
It's both. We started on the computer, and then it's hands-on. And the patient is involved with this process, so they get exactly what they wanted.
Okay, so when she sees, and if you don't remember, I understand, but when they see their face in the mirror, because this is dramatic, for the first time, what do they say? What do they do?
You know, honestly, most of the patients, sometimes they cry, sometimes they just give us a hug, and they say, oh my gosh, I can't believe what you've done. You know, this person, she actually waited years to get this done. And patients, they'll say this all the time. I don't know why I waited so long. Typically, most of these patients are putting this off for 10 years. I don't know why, but so many patients, they keep putting it off for 10 plus years, and they are so sad that they missed out on those 10 years of their life where they could have had this done.
Good point. Good. You know, I told you my father went through this procedure. 86 years old now, but he went from 48 years old until 75 years old wearing a denture. And when he finally got it done, which he exaggerates about everything, he said it didn't hurt at all, but he said, and you say that patients don't complain about pain too much, but when it was all done, he'd go, Randy, why didn't you talk me into doing this earlier? And I had been begging him to do this for 10 years, right? Is that the way patients are? Like, they just go, why did I wait?
Yes, that's what patients say all the time. Why did I wait? The best time to do this is today. You know, why wait? And Randy, if you look at her, would you say in the after she's more attractive?
Yes, yes.
Teeth make you look more attractive. Our smile is everything. People, it's one of the first things they see about you.
You say people with bad teeth are judged.
Absolutely, Randy. Look at the movies. Look at everything we do. we typically say if you have bad teeth, you must be a bad person or you must be poor, which is not the case at all.
That is a good point. Like in the movies, the poor person always has the bad teeth.
Yeah, that's the way Hollywood has done it, you know. But we know, or I know as a dentist, that this is not the case at all. People have just had a bad situation in their life that maybe they lost a tooth or they went through a hardship. But they're not bad people. They're actually very good people that just need help getting through this.
And you say some of these people with really bad teeth, they brush all the time, they floss.
Yeah, these people actually, believe it or not, try to take better care of their teeth than you or I do. But for whatever the reason is, they didn't grow up with fluoride in their water, or they had a tooth that broke. And it's just one thing that leads to another.
So it's like a bacterial infection.
Yeah, it's a bacterial infection, absolutely.
And they can't brush and floss it out.
Nope, they can't brush and floss it out. So they lose teeth, you know.
You say people come in on the consultation with you, and they're at the dental office, and they don't even like to show you their teeth. And they'll say, "Doctor," they'll say, "Doc, I bet this is the worst you've ever seen."
Yeah, patients will say this is the worst they ever seen, and oftentimes we'll say, "You know what? You don't even make the top 10." You know, because we see some pretty bad teeth, you know, but it doesn't matter where they're at today. It's what we can do for them. You know, typically these people will have bad teeth and you don't even see them. They are actually walking around all the time. They just don't smile.
You say it's a big boost to their self-esteem.
It's a total boost to your self-esteem because the first thing they see when they look in their mirror is their teeth. And if we can help them get better teeth, nicer teeth, they typically do better. They have better jobs. They're happier in life.
Now, in North Dakota, because you grew up there,
Yep.
do you ever work on maybe high school buddies or things like that? Do you ever run into people like that?
You know, honestly, I see tons of people from small towns. You know, that's maybe one of the things that's different about me. And, you know, I see farmers, ranchers all the time. And, you know, they're too busy or they just never been able to take the time or justify the expense to get this done.
Okay, now insurance, and we're talking about, if you're just tuning in, replacing missing teeth with dental implants. Dental insurance doesn't really cover this. Medicare, Medicaid definitely doesn't cover it. But you say people are financing this.
You know, Randy, honestly, people finance this all the time. We have companies that we work with to help patients. But, you know, as any big purchase in our life, we typically finance it. If you were to go out and buy a home tomorrow or you're going to buy a new car, you would finance it. Yeah. And so these are the options we have for our patients.
So you have lenders that finance dental work?
All the time, every day. Let me show you this next patient.
All right.
Really nice guy. Actually, he's been a plumber his whole life.
Okay.
You know, he had a great, successful plumbing business, and he just never took the time to take care of his teeth. What motivated this guy, he actually told me that his mother on her dying bed said, "Blue, I want you to get your teeth taken care of. You've had this for many, many years. I know they're bad, and this is what I want you to do."
That's nice.
Yeah. His option, at least he thought his only option, was getting a denture. Not at our office. We have a totally different solution for him.
Okay.
I'd like to show you how he actually came out when he was done.
He looks happy. Looks like a different guy.
He's so happy. He's actually a really great guy. He's a car collector. He's got a Corvette. He loves it. He's finally able to go out with his friends and be happy, and he doesn't have to hide his teeth. You know, he actually had a hard time eating before, but now he's able to go to Texas Roadhouse or any place downtown and eat the foods he wants. He doesn't have to avoid these places.
Now in North Dakota, isn't Bismarck like the place you go for shopping or good food, things like that?
Yeah, Bismarck is the largest city, the second largest in the state, but the largest city in all of Western North Dakota. So this is where people come.
So the most expensive part is going out to eat all the time?
Pretty much. It is for him now anyways. I gotta tell you one more thing about this guy. He actually asked me when we were all done, how come it's so cheap? And I told him, I said, what do you mean cheap? And he said, the dentist I saw before you wanted to charge me twice as much as you guys charge us. And I said, listen here, Blue, we have a process that in our office that we're able to keep the costs low, and I pass those savings on to the patients. Those other dentists, they actually have to work with the oral surgeon, and then they send out all their cases, and they have to pay all these middlemen.
So like they have to send it to a lab to make the teeth and all that?
They have to send it to a lab, they have to get a denture made. We don't do that. We streamline the process.
Because you're doing it on site.
We're doing everything in-house, and we're able to give a much better product at a much more affordable price to our patients. And this process is so much more efficient.
Like faster.
Yeah, absolutely faster. So it's a better result, more comfort, and cheaper price for the patient.
Okay, so somebody watching this, they have no teeth at all, or they have teeth that are just have to be removed. If they had an opening today in your office, the day after tomorrow, they can get their upper and lower teeth. I just want to make sure we're clear on that.
Yep, absolutely. Happens all the time. This is not something that, well, we don't do this too often. We do this all the time.
Is this the focus? I mean, I know it's not a recognized specialty, just dental implant dentistry, but this is your focus. Is that correct? I mean, this is what all you want to do. I don't want to put words in your mouth, but is that true?
Yes, this is my passion, is getting people implants so they can be back to the way they used to be when they were younger.
Now, after dental school, because we talked on the phone, I mean, you're always going to meetings or continuing education to learn about implant dentistry. We're here in California. You're going to LA, Los Angeles, for another course. Is there that much to this?
You know, there really is. If you want to do it right, there's that much to this. And if you care about the products that you give your patients, there's a ton to this. You're right. After this course, I'm leaving, and we got a course that runs through the weekend, Saturday, Sunday, get back home late Sunday night, and back to work on Monday, learning the best, newest procedures available.
So they don't really teach this stuff in dental school currently?
They don't teach it in dental school, and honestly, not too many people know how to do this.
Okay, good. Next photo. We have time for a few more.
Randy, here's a guy,
All right.
Thomas.
Oh my goodness.
Really great guy. Came in to see me. He just gotten to the point where he couldn't do this anymore.
That is bad. Is that unusual?
You know, it's actually not unusual. These are the people that just don't smile.
So you don't see it.
You don't see it.
What's going on there? I mean, what's causing that?
He's got a bacterial infection. He's got multiple decayed, broken teeth. Bottom teeth are very loose. He came to see me, and he had basically two options. Option one was an upper and lower denture. Not in my office.
Okay.
We had a solution. We had something that doesn't come out. And this is what he ended up with.
It's very nice.
Yeah, he's so nice. Honestly, I felt his teeth were just a little too white, but this is what he wanted, and the patients get to choose the teeth that they've always wanted. He went from, when he came to see us, he actually couldn't eat half the foods he wanted to eat. He loves eating meat. Couldn't eat it anymore. And now, what we gave him something that he can eat exactly the foods he wants.
Now, you say they start smiling more, like their whole identity changes. Because that's a good-looking smile, by the way. So I'm sure he gets compliments.
This guy smiles all the time. When he comes in to see us, he actually brings the girls candies. He's so thankful for what we've done for him, and he's very happy. Randy, I want to show you this last patient here.
Okay.
She came in, she didn't even want to smile for us. She was so embarrassed by her teeth.
Okay.
And, you know, she just asked, is there something I can have other than a denture? And I said, you know, Denise, let me show you these other patients that we've helped out that are just like you.
Okay. Do you ever get excited? I know they come in with a bad story, but in your mind, do you ever go, boy, this is going to be good?
All the time, because, you know, I like to be able to take someone from where they're at today to where I know that they can go. I'll show you what we did for her. We took her teeth out, top and bottom. There was no saving them. And this is the same day that we took her teeth out. She came in looking like I showed you, and she left looking like that. She is so happy. She's not yet showing her teeth, but you give her a couple months and she's gonna be smiling so big. She just has to get used to it again.
So bigger, do they start taking selfies of themselves and post it on Facebook? I think we talked about that.
Yeah, you know, these patients, it takes them a little bit of time, but eventually they start taking selfies of their teeth. They post them on Facebook. They're showing all their friends. And it's perfect because we're getting close to the holidays. She should have a great time over Christmas, Thanksgiving.
So this can be done very quickly. And by the way, so, you know, they can come in like on a Monday, if you have an availability, and on Wednesday they get their new teeth. You're saying they could eat like a softer foods at the beginning, and then eventually eat whatever they want. And how long do they last? How long are they supposed to last?
As long as you last.
Okay. So if you take care of them.
If you take care of this, they'll last forever. So we actually have our patients come in every 3 to 6 months to make sure that
Get them cleaned.
to get them clean and make sure everything's staying healthy.
So what are these teeth made out of? Is it an acrylic or like a hard plastic?
You know, some places they'll do acrylic, which is essentially just the denture teeth, the one thing they didn't want. We actually use zirconia. It's the best material available in dentistry. It's
Okay.
very hard, very durable, very lifelike. It gives them essentially the teeth that they always wanted.
Okay, and they could chew.
They can
you-
chew whatever
Do
they
they ever
want.
call you and say, "Doctor, are you sure I could eat this or eat that?"
They
Are
can
they a
eat,
little worried at the beginning?
they can eat apples, corn on the cob, steaks. It doesn't matter. They can chew anything. Do we have time for one more
Yeah,
photo?
go ahead. We have about a minute left.
Here's this last one. She was actually missing her back teeth, so she's wearing a partial denture. Well, this partial denture had caused her front teeth to go bad, and now her only option was a denture, or at least that's what she thought. We actually had something else for her, and I told her, Paige, look, this is what we can do for you.
So upper and lower teeth that don't come out.
Upper and lower
Let's take
teeth
a
that
look.
don't come out.
Oh my goodness.
She looks younger. She feels better. Amazing results.
It's a pretty smile.
Beautiful smile. She can eat salads, steaks, corn on the cob, anything she wants. She's happy. She smiles all the time. She came in, she wasn't smiling that much, didn't like the way of her teeth. We lightened them up. We gave her teeth that fill her whole mouth. She's very happy with this.
You're right about where you say she looks younger, and in the after. Teeth, I guess, as you say, will make you look younger.
They do. They make you look younger. They make you feel younger.
Okay, good. We're out of time. Final message. The two groups you talked about, the people with really bad teeth that are probably headed for dentures, or the denture wearers. Maybe they've heard what you had to say, but for whatever reason, they're skeptical, they're afraid of the dentist, whatever. What do you say to them?
I invite them in to come and see us. We offer complimentary consultations, and we'll go over your options, give you something that'll change your life.
Are they going to meet with you? Do you meet most of the consults?
I meet all the consultations meet with me directly, and then I develop a custom treatment plan for them.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.